Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow, MD, and Dr. Thomas Grove, DO, from the Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Dr. Grove is a regenerative medicine specialist and an expert in ultrasound-guided injections with extensive experience as an athlete and strength and conditioning coach. Today's program could open up a new life without pain for you. To speak with Dr. Darrow and Dr. Grove, call 866-870-KRLA. That's 866-870-5752. Ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Regenerate, don't operate. Now, here's Dr. Darrow with his co-host, Dr. Thomas Grove.
Hello there, ladies and gentlemen. It's my great pleasure, this is Dr. Marc Darrow, to present information on stem cells and platelet therapy for your orthopedic injuries, arthritis, neck pain, back pain, all the joints, anything from, all the vertebrae in the neck and back to the elbows, to the wrist, the hips, shoulders. We do tons of shoulders, knees. My God, that's they say that's the first thing to go. Toes, ankles, hamstring tears, wrist arthritis. Yeah, arthritis is a big thing that we get. And people come in ready for a joint replacement, and we examine them, and they tell us they're ready for a major joint replacement. Some of them keep them out of the game for, a year or so if they ever get back in. And we kind of laugh, and they go, "Why are you laughing?" You go, "Because there's nothing wrong with you. You just have sometimes this little sprain of a joint." And then when a doctor takes a look with an MRI, X-ray, or CT scan, they see these horrible things that are not even related to what their pain is about. And if anybody wants a free copy of our book, which is Stem Cell Therapy and Platelet Therapy, Regenerate, Don't Operate. That means regrow the tissue with stem cells or platelets. Don't operate to take tissue out. Please, please, please think about this. You can get a free phone consult with our staff by calling the office right now, if you like. They're by the phones. 800-300-9300. Grab your pen or pencil. Write this down. It can be a lifesaver for you. Seriously. 800-300-9300. And I don't mean that lightly. I've seen people die on the operating table. Horrible things from anesthesia. And that can happen to anybody. I just actually had an operation recently, not anything orthopedic. And I was gorked out for like a month afterwards from the anesthesia. I never thought I was going to come back. And thank goodness I am. And I'm back to sprinting in the park. I'm going to go play golf today. You can see I've got my golf hat on and my golf shirt. So it took a long time for all those things to clean out of my system. And I was very, very nervous about them. You can have a very simple surgery like I did, and it can really wreck your life. I did have a surgery on my shoulder when I was in medical school that wrecked my life for a while. Many years, actually. It took about 4 years to get it healed, even after the failed surgery. And the reason for that was I went to a seminar about prolotherapy. That's the old form of regenerative medicine using dextrose, concentrated dextrose. Not very strong, but it's all we had back in the day. And after 4 years of misery, after a failed shoulder surgery, I injected myself, and I woke up the next morning 100% pain-free with full range of motion in my shoulder. And at that point, I knew I was not going to be giving steroid injections to people or just sending them to physical therapy or to the surgeon. I was going to start doing regenerative medicine. That became my life. My life's work, actually. I was one of the first guys to do it, and I think I made it popular. I think I was the guy. Thank God that it came to me because I did quite a bit of promotion with it. Lecturing all over the country. and wrote a book about stem cell and platelets. And now it's all over the place. All doctors are learning about it. Unfortunately, the orthopedic surgeons still don't believe in it because they're trained to do orthopedic surgery. But I was thinking back to when I first started talking here. I'm going to give out the phone number again so we can get some callers in here. The phone number to the studio, write it down, is 800-300-9300. That's 800-300-9300. And if you want to watch Dr. Grove, my associate, and myself actually doing these injections, go to the website. You can watch it right there in front of you right now. And that's www.stemcellinstitute.com. That's www.stemcellinstitute.com. And if we get any callers, we're going to give out a free book. It's a $25 book. It's got 200 pages, 256 scientific studies on platelets and stem cells. And it's something that you can read and teach your doctor what to do when their patients have orthopedic injuries or arthritis. So I see we have a caller coming in. I don't see the name yet. What else? Call into the office at 800-300-9300. My staff will give you a free phone consult on whatever your injury or your issue is. So I don't have the name for this caller. Here it is. Oh, my goodness. It's an old friend of mine, someone that we go back to the day of the dinosaur. It's Dr. Randy Weinzoff, a chiropractor in Santa Monica, who's been a great associate of mine for. Randy, can I hear you? Can you patch him in?
I hear you clear.
Oh, great. Randy, how long we been friends for?
15 years, I think.
I think at least, yeah.
Yeah.
I've been doing this work for almost 30 years, and you've been there half of it. And I just want to give a shout-out to Randy. Thanks so much for calling in. I want to hear your story in a second. But I send all of my radiculopathies to Randy Weinzoff. He's a chiropractor. And patients come and they say, I already saw a chiropractor. It didn't help. This guy is the guy who can get it done. I don't know exactly how he does it. He gets rid of these nerve compressions in the spine. And the first time that I sent someone to him was a case of what I'll call a dead leg. I don't know if you remember that, Dr. Randy.
I do.
And guy goes to see him finally. I had to convince him to go see him. He got into Randy the first day, and he walked out. His leg was fine. Can you explain, Dr. Weinzoff, how you fixed that guy? Because it's something I still don't understand.
Yeah. So I do something that's slightly different. It's not something that everybody does. For me, the diagnostic portion of it is the real important part. So most of the patients who have a bad scenario have had MRIs and CAT scans and all these fancy diagnostics. I take a load-bearing X-ray, a digital X-ray, and by load-bearing I mean they're standing. So we actually get to see what the bone structure looks like while somebody is under their own body load and gravity, whereas if they go down into an MRI tube, there's no gravity on the body because they're lying down. So I get to see the bone structures are basically misaligned. So I'm looking at their bone structure like an architect looks at the frame of a building, and all I do is I straighten out their frame. By straightening out their frame, typically the discs stop bulging into the canals and pushing on the nerve roots.
Yeah, and I've sent you endless patients over the years, and I can't remember one who didn't do better. And,
well, we do the best we can. We're not at 100%, but we're probably above 80% in terms of correction.
By the way, Dr. Weinzoff, this is Dr. Randy Weinzoff who just called in. What is your phone number at the office? Because if anybody has what we call a radiculopathy, I handle all the local pain issues, but when there's somebody that has pain down an arm or leg, that's a different story. That's something that often I cannot help with. So I'd like to get people to get your phone number in case they have that.
Sure. The phone number in Santa Monica here is 310-395-0260.
That's amazing. Dr. Weinzoff, thank you so much. We have another caller coming in. But actually, I've worked on Dr. Weinzoff, too.
Yes. Yeah, I've had amazing success. You're pretty much batting 1,000 for me for torn tricep tendon, torn patellar tendon, low back sacroiliac joint. You're my guru. So
actually, I'm thinking of my book that we're going to give out for free if anybody calls in,
yes.
which is Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Dr. Weinzoff's pictures, and they're laying on the table with me injecting his elbow.
That's right. That's right. You saved me.
Well,
great.
I'm glad
I appreciate
I can.
the time.
Yeah, and you've helped me too. I've gone in to see you when I've had things, tweaks to my body that have bothered me that I wasn't able to, things that my work of regenerative medicine with stem cell and platelets wouldn't really hit the spot. There was also one time you had herpetic neuralgia.
Oh my God!
Herpes,
I had the worst case of shingles ever.
Yeah, and we were able to get rid of that with a few treatments. Well, God bless you, man. I appreciate you calling. We have another caller here. I'm going to take him. His name is Dave from Nicaragua. Oh, my God. I can't wait to hear what's going on here. Dave, can you hear me?
I can hear you, Doctor. How are you?
I'm living it up, man.
Well, I'm sitting out here looking out the window at the Pacific Ocean.
Wonderful, wonderful.
Are you still there?
I'm here.
Okay, because I heard a dial tone there.
Yeah.
I just wanted to talk about the discomfort I was having in my shoulder a while back. Before I came to see you, I had kind of strained a little bit. And as you know, you guys treated my left shoulder and told me to take it easy for a little while. And then about 3-4 weeks later, I thought, well, it's too much strain on my shoulder, and I decided to start playing golf left-handed, which didn't put strain on it. But then I got some softer shafts and started swinging right-handed and went out and started playing, and somehow or another, miraculously, the pain was gone in that shoulder. Still feels really good.
Well, you know what's so funny, man? The first time I did it on myself was my right wrist from a golfing injury, of course, where I hit the ground trying to hit a ball up over a tree, so I hit down real hard. And I didn't hit the ball, I hit the ground, hyperextended my wrist. And I've got a nice lump on there. I'm going to show it to the camera right now, an arthritic lump. And I was in total misery for a while. And then I injected my wrist, and that's been gone now for, my God, I think it's 27 years. So I'm hopeful for your shoulder that...
well, I hope I have the same luck with my shoulder as you had with your wrist. But so far, so good.
Yeah, well, I'm glad that it's doing well now, and let's hope it stays. How did you get into playing left-handed if you're a righty?
Well, when I was a kid, I was ambidextrous, and I would carry a left-handed club in my bag in case I got up against a fence or a tree.
Smart, yeah.
And you may recall when I first came to see you, I told you I had damaged that shoulder about 30 years ago. And I
don't recall. I didn't know that, yeah.
Yeah, well, I stopped golfing for about 5 years, and finally I said, well, let me start golfing left-handed, and I did. And I did that for quite a while. And finally, just on its own back then, it finally got to the point where I could swing right-handed again. And when I overextended this time, I kind of felt the same thing. So I thought, well, I don't have the time to wait.
Yeah.
So I decided to have you do some treatment on it and hopefully speed up the process. And
so are you still playing lefty at all, or are you just righty now?
Well, I chip left-handed now, but I'm playing right-handed again.
Well, you'll have to show me that technique. I could certainly use some help on my chipping. I was out at the range chipping yesterday. I was sculling every ball, shanking it.
That doesn't sound like you.
I can always use a lesson. You know what I tell people when I get to the golf course and I get to my foursome? I always start out by saying, anything you guys have to tell me about my swing, I want to know about immediately because I'm a constant student. And Dave, you may know that I was in college for 22 years. I did law first after 4 years at Northwestern. Then I was a lawyer for 15 years. Then I did master's of tax 10 years into that at USC. And then I went to medical school. And then even after medical school. Now you're studying the golf swing. And now I'm studying the golf swing, right. But I don't get better.
Another 5 or 10 years, you'll have it down pat.
With your help, I hope. Anyway, you're free to give me lessons.
I hope I can help you.
I hope so, too. Anyway, God bless you from Nicaragua. How's the weather down in Nicaragua today?
It's sunny and clear. It's early in the morning here. I think we're an hour ahead of you. And it's already pretty warm. But it's beautiful down here. I'll be back next week.
Wonderful, wonderful, wonderful. All right. Well, God bless you, Dave. It's a pleasure hearing
All right,
from
have a
you,
great
and
day.
and enjoy Nicaragua.
Will do. Thanks, Doc.
All right. So you've just heard a couple of good stories and my story. So that's 3 of them that have been what I used to think were miracles when it first started happening. I couldn't believe it because all I was used to doing, all I was trained at UCLA was to send people to physical therapy and then do surgery if that didn't work. And medicate people, of course, that shuts them up, makes them zombies so they don't complain. All of which I'm not for, as you can kind of tell. So I wanted to get back to Dr. Weinzoff, who I mentioned before, the chiropractor in Santa Monica. He refers patients to me. I refer patients to him when indicated. And I said that I send all my radiculopathies to him. That's pain down the arms or legs. But that's not actually true. And I just thought of a story while he was talking about a woman came in, middle-aged, very nice woman, and she had some back pain. She had a back surgery. They replaced a disc. I don't know what the heck they were thinking. And she woke up from the surgery with a numb foot. And we call it paresthesias, numbness, tingling, and very painful. And while I was examining her, I touched the side of her leg. It was her right leg. And she kind of jumped, and so that really hurts, and it's tingling. And I put my fingers along where the perineal nerve is, along the side of the calf, on the outside of the calf. And she was like, don't do that. That really hurts. And it goes into the foot. So what I had is Dr. Grove, who's our main injector now, come in, and I said, I think this is a perineal nerve impingement due to the surgery. Not anything to do with the back. And by the way, this woman was told she had to have another back surgery to clear up what was going on with her leg and the foot. So Dr. Grove took a look, and he concurred with me. And I said, do you think we can do a hydrodissection? That's a very simple procedure. And everything is done under ultrasound, so we can actually see these nerves. We can see exactly where the needle goes, so it's not going into a deep, dark space where it's going to miss the spot or cause a problem. So he did a hydrodissection, and almost all of that paresthesia down the leg was gone when she came back. I don't know if it was a week later that we saw her. And the foot issue is still going on, but the leg issue is gone. And she didn't understand how lucky she was that it wasn't coming from the back. And this is something that people have to understand. You can't press a leg and get pain and think it's coming from the back, okay? They're 2 different issues, and that's where the MRIs lie. They're just total liars about what's going on. Her MRI looked terrible, looked like she'd have a surgery, but she had a surgery, and it made her worse, much, much worse, and it caused the problem she has today. And one of the things that we see commonly is we get these perineal compressions from surgery. Now, it's not because the surgeon is working on the leg where the perineal nerve is. It's because when someone is under anesthesia, they're like a bag of potatoes. They're getting pushed around, and that perineal nerve can be injured and compressed. And so we just put on our thinking cap and went, this doesn't seem to be coming from the back. It seems to be coming from a surgical issue caused by surgery. And it's very, very common. So often people are strapped down in surgery. They're pushed around. They don't know what's going on. They're under anesthesia. And that was the case with this woman. So when she came back, we played with the area around the ankle where she was having this paresthesia starting into the foot. You'd press around the ankle, and her foot would light up. So Dr. Grove then hydrodissected that. We're waiting for the results. We won't know till she comes back this week or next week. But we are praying that this has nothing to do with her back at all, and it just has to do with these nerve injuries from the surgery. So we have to be very, very careful. We always tell the patients, be careful of the pathology versus the reality. And this is so important. Almost all the patients that come in have the wrong diagnosis. Why is that? Because doctors are not putting on their thinking cap and they're looking at their images and deciding what to do from that, and then medicating people. That doesn't do anything. We use our hands and we move people around to find out what's going on. And most regenerative medicine doctors do that. Not all of them do that. We do that. That's how I was trained, by using my hands. My grandfather was a natural doctor. He was born in the 1800s. He didn't have MRIs. And most of what he gave people was placebo, cherry syrup. And got a lot of healings that way. People go, well, it's just placebo. Placebo heals about 40% of people. I wish placebo healed everybody. I wish everything we did was placebo, instead of doing invasive surgeries and things like that. So if you want a free copy of my book, Regenerate, Don't Operate, it's a story about stem cells and platelets, how to heal your body without needless surgery, without dangerous surgery. What we do is simple. You walk in, you get an injection, and you walk out. It's that easy. So give us a call at the studio if you want to talk to me live. That's 866-870-5752. My number here, you can talk to me live, get a little bedside consult, ask me any question about orthopedic surgery, about anything to do with your orthopedic injuries, anywhere from the top of the head to the bottom of the feet, arthritis, neck pain, back pain, knee pain, hip pain. If you're ready for a surgery, please call me. The phone number to the studio again is 866-870-5752. And if you want to call my office and get a free phone consult with my staff, get a free copy of my book, it's 800-300-9300. That's 800-300-9300. And the website, you can watch Dr. Grove and I doing these actual injections, see if it's something you want to do. That's www.stemcellinstitute.com, www.stemcellinstitute.com. We love educating people. We spend lots of time with our patients, and we explain things. We show them on the internet what's actually going on with them. When Dr. Grove does his injections, the ultrasound has a big screen. He shows the patients what is actually going on. And the nice thing about the ultrasound is that it's live. You can move the body around and show what's going on. A lot of things show up on ultrasound. It's much more sensitive than an actual MRI, which is static. The body is not moving. You're lying still. So we like the use of the ultrasound. MRIs are good for some things, and ultrasound is good for some things. Neither is good for everything. But you got to put it all together to figure out what's going on with the puzzle of the body. And always remember, pathology versus reality. That means don't believe your diagnosis, don't believe your films. Find out what's really going on. Get a doctor who uses his hands to diagnose and puts everything else together with it. There's enough of this going on that people are starting to believe in stem cells and platelets. Back in the day, I had to convince people to experiment with it. It's not an experiment anymore. You go on the internet, you're going to find endless information on the healings that can take place naturally. And that's what it's all about. The main thing is medicine is be conservative, stay away from surgery. Surgery can hurt people, and we just see too many failures. There are actually diagnostic codes with insurance companies, things like failed back surgery. That means there's got to be so many failed surgeries that they actually have a diagnostic code for it. That's a brain twister, right? Why are they still doing these surgeries? I don't know. I really don't know. I'd say 99% of these orthopedic surgeries should not be done. We see the bad results. The people that have had the failures come to us. But that's life. Medicine is slow to change just like everything else. And I think about back in the 1600s, there was an astronomer named Galileo, and everyone thought the earth was flat. And he said, no, the earth is round. And he was inquisited. He was brought before the Inquisition. We're going to the break. Call my office if you want a free phone consult with the staff, 800-300-9300. And we'll see you on the turnaround here. God bless you all. Hang with us. We're going to go to the second half hour. We love you all. We want you to heal.